Thank you very much, Lesley Corlin. First of all, I want to thank Sinn Féin for bringing this very important motion here to the Chamber tonight to give us a chance to highlight some of the needs and deficiencies that we have in our constituencies. And indeed, I suppose, Lesley Corlin, in Kerry and in Killala in particular, we have a critical lack of GPs to service the needs of the people in that massive area. And just to think about it, ministers, in the last few months, over 4,000 extra people have landed into Killala, refugees, asylum seekers. And many of these refugees are mothers with young children. They need vaccinations. They need all the things that children need. And not one extra GP has been dedicated to this town of Killala. Indeed, Gary Stack and Dr. O'Regan, two doctors, they're under immense pressure. And there's others. And they were under pressure before this at all, ministers, because they were short of staff. And that replicates then that more people have to go, they're directed to the A&E services in Tralee General, or Tralee University Hospital. And that's having an impact there as well. And there's just one small thing I would raise before in relation to the A&E. When people break a leg or break a hand or have a fracture, they're directed by their GP to go for an X-ray. When they go for the X-ray, they're directed back up to the A&E to be seen by another doctor. That's duplication, that's replication, that's not needed. And it is impacting the other elderly people that are there waiting. There's no need for that. When a doctor gives them a letter saying that they need an X-ray, that's what they should get and not be clogging up the system, and give them the X-ray. So I welcome the 132-bed hospital for Killala, community hospital. It's something that I raised when I was a member of the health board back maybe 10 or 12 years ago. I honestly feel I was the first at that time to raise it, and I'm glad, because we have great doctors and great nurses in Kerry, in Killala, in Tralee, and we need to give them the best facilities, and they need to have the best facilities, modern facilities, so to make their life, their work that bit easier. Home help, we're clogging up the hospitals, be it district hospitals or the Tralee General, because of the lack of home help. Now people are being allocated home help hours, but we don't have the people to come out and do it. I've asked before that the refugees, some of them that have cars and who have good English, that they be trained up and give them a purpose here. And they're able to work like everyone else. And I'm asking that because I do appreciate that people are very hard to get. Mental health is a serious problem in our county, and people are being left down. I know that suicides happen outside of the, we'll say, the medical spectrum, and it happens unavoidably or whatever, but there are more people that need more mental health services. They need one-to-one service, and it's not good enough to be just like we see with CAMHS, and that's replicated now from South Kerry. There was a junior doctor blamed in South Kerry, but it's replicating in North Kerry now as well, and that doctor wasn't there at all, and I believe it's an issue that needs to be dealt with all over the country. Ambulance cover is impacted because of people being in trolleys, and when the ambulance backs in and they can't unload the patient that they have, that leaves somewhere else without an ambulance. And we have several instances where sick people were waiting for over an hour and 2 hours in some places. Cataracts, I'm glad that both myself and Michael Collins initiated a system where we take them up to the north of Ireland, and we have 106 or 7 buses now at this stage taken up since December 2017. And there's just one other thing, ministers. When someone applies for a medical card and they get it, they're entitled to get it. It should be made effective from the date they apply. I'm just asking that because some people let it go and they don't look for the medical card till they get sick.